Welcome to the Rapid Area Assessment Report of LP7. Today, we will be focusing on the health readiness of the Correctional Institute for Women amidst COVID-19. Persons deprived of liberty share the same rights to health and well-being like everyone. That is according to Rule 24 of the United Nations Standard Minimum Rules for the Treatment of Prisoners, otherwise known as the Nelson Mandela Rules. Our RAA objective is to assess the capacity of the CIW in handling emerging diseases such as what our country is facing right now, the COVID-19. We want to know what is the existing healthcare condition in CIW, what are the strengths and challenges of the CIW health system, how will CIW fare in the threat of COVID-19. The CIW was established in 1929 by virtue of Act Number 3579. It was to be the first of 2 women prisons out of the 7 units of the Bureau of Corrections. The Bucor is an agency under the Department of Justice. It is currently headed by Director General Gerald Bantag. His direct report is the newly appointed CIW Superintendent Virginia Mangawit. In 2013, President Aquino signed Republic Act 10575. The act aims to modernize Bucor by providing funds for the upgrading of facilities and increasing the number of personnel. Unfortunately, the budget has been delayed.
This study, we use SWOT and PESTLE in conducting the situational analysis of CIW. For the strengths and weaknesses, we are looking in the internal capacity of CIW derived from the data we had collected. Infirmary infrastructure in place. The infirmary has a waiting area, reception, dental clinic, doctor's consultation room, nurse's station, and isolation room. Moreover, the infirmary has 33-bed units as well as medical supplies coming from the New Bilibid prison. An ambulance service is also available for transportation of PDLs to partner hospitals if needed. Skilled human resource. With the present number of staff, the prison infirmary is manned by 1 to 2 health workers at any given time. The dentist is available during office hours, and PDLs were provided health seminars to be first responders for their respective dormitories. Women empowerment. Activities such as livelihood programs and ALS that promotes empowerment of women are available inside the correctional. Enough basic equipment and supplies. The infirmary has the basic medical equipment and supplies to meet the DOH requirements for a primary care facility. Hygiene supplies are also provided with steady accessible water supply and drinking water. Cleanliness and sanitation practice are also in place. Stringent visitors screening is in place. Masks are mandatory for all visitors as well as temperature check and hand disinfection. Dynamic and decisive leadership. CIW is very decisive in purchasing equipment such as face masks and temp guns in facing COVID-19, and on March 10, 2020, prior to the announcement of the ECQ of Metro Manila, the CIW and all penal farms and prisons under Bucor were immediately put under lockdown. In terms of weakness, prison congestion and physical distancing is a glaring problem of the facility. The dormitories are packed to maximum capacity with limited ventilations. The prison has already utilized common areas such as laundry room and hallways as dormitories. New PDLs stay on small quarantine areas. Those transferred on the receiving area stay in the lobby of the learning center. As of this writing, there are 47 patients admitted beyond the 33 limit of the infirmary. Some of the patients have to stay in the hallway on foldable beds. In terms of susceptibility of the population, there are 650 PDLs over the age of 60, while at least 30% of population have pre-existing conditions, and isolating them will be impossible. Limited human resource. The current COS ratio to inmates is 1:100, with ideal international ratio is 1:15 only. Limited population with health insurance. Not all of the PDLs are enrolled in PhilHealth. And lastly, CIW has substandard facilities reflected in their infirmary, as electronic records of PDLs are not currently available, such as demographic data and prevalence takes time for retrieval. So right now, we go on PESEL analysis.
After identifying the strengths and weaknesses using the SWOT analysis framework, we move forward to identifying the opportunities that CIW have in the future using the PESEL framework of analysis. First in our list would be on the political side. We have identified collaboration between DOH and DOJ as an opportunity wherein DOJ would be able to learn and benefit from the competency and expertise of DOH as far as healthcare services are concerned. That's something that DOH can extend to CIW in the future. The other one is the Bayanihan Act, wherein the President has been given special powers to reallocate funds that would focus on the healthcare needs of the people that would be affected by COVID-19 in the event that CIW would also experience the same in the future. They would benefit from the Bayanihan Act that the President may bestow on the PDLs of CIW. On the economic factor, the mass production of face mask is an opportunity for the PDLs to have an alternative for the face mask that is lacking in the commercial space. Likewise, earn from it as they are able to produce more that they can sell in the public. The third factor is the social factor, wherein we see that there are a lot of donations coming from the international community on medical kits and other healthcare products that would help combat COVID-19 in the future. Again, if CIW would find a need for those, they would have access to the same resources that could protect them or mitigate the challenges that we will be experiencing with the COVID-19 outbreak. The fourth factor is technological. Now, given the lockdown, our PDLs are not able to receive visits from their family members and relatives. So we see an opportunity for the technology to play into the picture by looking at the possibility of setting up a virtual conferencing wherein family members can still quote-unquote visit the PDLs via Skype or Zoom as an example of the technologies they can use. And lastly, on the legal side, there is this human rights guideline that the Philippines can observe as an international obligation when the need arises for the PDLs for their rights to be protected.
At the onset, we note that there is no perceived technological threat to the CIW. More precisely, technological advancement in general healthcare has the potential to contribute to the PDLs. As to the threats identified by the group, we have first, political. The budget allocated for the modernization plan of the CIW, which has not yet been released, may be in danger of being reallocated because of the emergency powers given to the President, where he can realign budget already allocated to the CIW. This will further the delay of the modernization plans. As to economic, the industrial center, where PDLs create handicrafts, is a source of income not only for the PDLs but also to the CIW. With the disruption of inflow of raw materials and the decrease of tourists who buy their products, the income through the industrial center that may be used for the healthcare of the CIW is also disrupted. As to social, the CIW relies heavily on donations. But with the pandemic spreading in the Philippines, donations that may have been for the CIW are now reallocated or focused towards other causes. The more glaring impact for the PDLs is their isolation from their families as visitations are halted. As to legal, the suspension of the good conduct time allowance prevents the decongestion of the CIW. Qualified PDLs who may be released are unnecessarily detained, which increases the threat of congestion. Finally, as to environment, the uncontained outbreak of the COVID-19 in the surrounding cities continues to threaten the whole population of the CIW.
As part of final presentation for our RAA, I'm going to present on conclusion and recommendation. And for conclusion, we have looked at the existing conditions as CIW, So CIW has basic health structures and facilities where they provide daily basic health services to the PDLS as shared by the infirmary and medical professionals at the center. CW is not prepared and equipped to handle the possible epidemics of diseases outbreak like the COVID-19. And there is lack of modern facilities, structures and space which has led to congestion, and there is high risk of transmission. And coming to the strength and challenges, CW has newly appointed proactive superintendent. She is very much concerned about the CIW and she is working very hard to facelift the overall condition of the institution. CIW provides basic facilities and supplies for the PDLS to keep them meaningfully engaged and also to impart survival skills. And coming to the challenges, there is congestion in CIW. The existing structure has created congestion as it has exceeded the capacity of CIW. There is lack of workforce. There is lack of readiness to respond if the COVID-19 outbreak gets into CIW. So our group has done the SWOT analysis thoroughly, and we have come up with 5 major recommendations. And these 5 major recommendations are purely based on our SWOT analysis. And the first recommendation that we are proposing to CIW is interagency partnership. So here we are proposing DOH to spearhead the overall health services in CIW to improve and provide better health services to the PDLS. And second one is enhancing current good practices, where CIW should strengthen the current SOP for the visitors and to combat the outbreak of disease like the COVID-19. And the third one is modernization strategic roadmap. So we are also suggesting CIW should come up with the modernized strategic roadmap for the next 5 to 10 years to improve the overall conditions for the PDLS. And the fourth one is enhancing the health of PDL community. So we are recommending CIW to come up with different programs to improve the physical, mental, social and financial well-being of the PDLS. And the last and the final one is building strong networking and support system. So we are also recommending CIW to explore how they can build a strong networking and support system with the private community to benefit the PDLs, to keep them meaningfully engaged and also to improve the overall condition at the center. So these recommendations are purely based on our RAA reports. Thank you.